Now, I don't believe malpractice reform is a silver bullet, but I've talked to enough doctors to know that defensive medicine may be contributing to unnecessary costs. So I'm proposing that we move forward on a range of ideas about how to put patient safety first and let doctors focus on practicing medicine.
That was President Obama addressing Congress and targeting tort reform as one of the many problems he looks to remedy with his new health care reform. And that was September 9th. Now it is November, and a version of the health care bill has just passed the House by a close vote. This version does not include any reforms pertaining to medical malpractice lawsuits. Some doctors see this as a failed attempt at reform.
I think that having a health care reform in this country without attempting to alter how we deal with medical malpractice is not going to be very successful.
With the recent lack of support for tort reform, Obama may be losing favor with doctors.
I think he lost the doctors on 60 Minutes when he was interviewed by a very intelligent CBS reporter who said to him, all the doctors and hospitals in this country are saying to you that it's absurd, Mr. President, to have health care reform without having liability reform.
New York State malpractice insurance is among the most expensive for doctors in the country. The high cost of insurance, malpractice suits, and defensive medicine have forced some to find work elsewhere.
Some of our best, youngest doctors that I personally know have left the state. Many of our older, more experienced doctors have just thrown up their hands. One of our best general practitioners in this community who took care of a lot of people at Stony Brook is now a real estate agent. Another of our best general surgeon has left and gone out to Arizona.
Doctors see a system that is needed, but one that is flawed.
Doctors aren't perfect. Hospitals aren't perfect. And during the course of taking care of Americans, mistakes are going to be made. And I think that those Americans that have had something truly bad happen to them are entitled to be compensated and taken care of in some way.
With no help coming by way of the federal government, doctors see their hopes of reform slipping away.
We're doctors. We take care of patients. We don't play in that type of ballpark, so we're not skilled in getting politicians to do what is best for us.
State help may not be too far away. According to the Medical Society of the State of New York, Governor Patterson is looking to enact some form of tort reform by the end of the year. For Stony Brook Now, I'm Ryan Famulari.